Hi, we are here at our Digital Health Vitals new episode. And first of all, I'd like to remind you to subscribe to our channel, as always, super important. Second of all, our guests, Ben Schwartz and Sergei Polevikov, with us today. Hi, Ben. Hi, Sergei. And a surprise, surprise, we have a new expert on our show. It's her. Her name is Stephanie Davis. Hi, Stephanie. Thanks for joining
Thank
us.
you for having me in the program. Appreciate it.
Since Ben and Sergey have already done a lot of intros on this channel, but you haven't, please tell our audience who you are, how are you involved in healthcare, and just, yeah, a little bit about yourself.
Yeah, absolutely. So I'm currently I do a lot of strategy consulting for different health tech companies in space, mostly on the private side, but a few on the public side. But prior to that, I was a health tech equity research analyst for an embarrassingly long time, like over a decade. So I covered all the public and private players, and I followed a lot of the news and what was going on in the sector.
That's awesome. Thank you. Well, yeah, looking forward to hear some of your opinions on the news that we selected for today. And yeah, let's kick things off and let's start with Verily, a company that has been in health tech for a very long time, a spin-off from Google. And with all this AI boom, I feel like we sort of starting to forget about Verily, but here they are. Verily secures $300 million investment to advance its precision health AI strategy. Uh, Guys, what do you think? It's time to talk about Verily again because I haven't heard from them for a while, and looks like with this new investment round, Alphabet is not a majority investor anymore. It's a significant minority owner of Verily. So yeah, it's not only owned by Google anymore, and Precision Health. Interesting.
I mean, this is kind of a sign to me. Sorry, I'm just jumping in. Isn't this a sign that maybe Verily has finally decided what they want to be when they grow up? Like for so long, they were just this weird experiment inside of Google, and I think they've decided that instead of being, a life sciences arm, then Google Health has been sunsetted for so long, right? It was getting sunsetted before David Feinberg even left. Like at this point, if they really want to pursue more of a health strategy, they kind of need to be their own animal.
Yeah, weird, expensive experiment inside Alphabet and Google, which now seems to be less the case. Like they're really splitting off on their own, trying to figure out who they're going to be. I think it's an interesting concept, right? The concept of personalized healthcare, which I think is where things need to move, and AI seems to be a great way to do it. I think the question is, can they get there? I think it's very high level right now. It'll be interesting to see how you actually get down in the nitty gritty and do that, because a lot of the studies that things are based on are not very generalizable. So you almost have to kind of, I don't want to say start from scratch, but you have to do a lot of the upfront work to actually get that granular with the data to be able to personalize treatment to people, because most of the time guidelines are sort of broad and not generalizable. So, I don't know that there's a huge body of data to work from. And so I think there's a lot of work to be done. So we'll see if they can do it.
Yeah, I don't know. I think maybe it's a dying off breed at this point. It's funny, like, what's like 2.5 years? I think they had like 3.5 billion, mostly from Alphabet. I think it's only Google can throw out so much money and basically say, forget about it. We don't really care what's going to happen. So it's really bizarre because I mean they've pivoted so many times in this 2.5 years, and now they're this AI native precision, what is like medicine platform, uh, shrinking all their businesses. As you mentioned, Alex, separating from Alphabet at this point. Their medical device program, they're shutting it down. They just closed this insurance subsidiary. They closed a bunch of R&D centers, fired towards like a third of its workforce. Yeah, so it's we'll see what happens. I mean, it's a big investment, but I feel like um, it's almost like it was like Sergei Brin's baby that continues kind of like having legs, but without the head or something. It's like but we'll see what happens. But it's been a really weird experience, just basically throwing good money after bad and just see what happens, and it never really happened, in my opinion.
My bigger question would be like, is there a lot of the large tech players starting to move away from health tech, right? Like I feel like in that kind of 2010 to 2020 time period, there was this like very interesting thing of a lot of large tech players saying, you know what, we'll become a health tech player, right? Amazon went in that direction, Google went in that direction. You saw like Oracle decided to buy Cerner, which felt like a little crazy at the time. And now you're hearing more and more these folks are distancing themselves from the sector. So is it just like that flash in the pan is over?
I think so. I mean, I think obviously the hype during the ZERP era and everybody, tech for a long time, I think has been trying to figure out how to break into healthcare, right? It's like this huge now $5 trillion industry that they're still trying to figure out, how do we get value there? It's a potential growth opportunity. Now it seems like maybe it's switching to AI, but I don't know if they've learned from their lessons in the past of, I think we're going to talk about this Microsoft Copilot story too, of, how do we kind of get into healthcare without getting into healthcare, or
Yeah.
how do we take our existing tools and apply them to healthcare rather than, we're going to jump full in and be a healthcare company. It's like, what are we doing right now that we can then apply to healthcare? Seems to be sort of the lessons learned in the next phase, because otherwise it's just too complicated, expensive, and too far away from their core kind of business model to really get into healthcare.
Yeah, as you know, Stephanie, the margins for this big tech companies, especially in AI, especially in healthcare, are not that great.
I mean,
And
they
so
structurally
I think they're
shouldn't be,
kind of like,
right? Like healthcare margins should always structurally be a little bit lower because it's an essential service.
right. But in the end of the day, they're basically comparing healthcare, or in this case, health tech, to their other businesses, and I'm sure
Yeah.
it's not on top of their list in terms of financial incentives. And so I think they're going to continue kind of throwing their money here and there, kind of like looking what's going to stick or not, just as an experiment. But for now, I think you're right. They're kind of cautious and just see what happens. AI in general, by the way, is not a high margin business as of now, so that's another problem.
Yeah, I think that's always the fundamental question, right? In healthcare is, you probably, if you're traditional healthcare or close to traditional healthcare, you're not going to get the kind of investor returns multiples that the healthcare, like a software SaaS play is going to get. And that seems to be always the fundamental tension, and why a lot of companies, healthcare companies, tend to kind of gravitate more towards the, the SaaS scalable, lower barrier to entry or lower cost to entry, instead of doing like traditional healthcare stuff.
I just have a last follow-up regarding this news. Let's forget about the history of Verily for a sec. Uh, Precision health. Do you think it's a good bet right now with all the AI boom happening? Why precision health and why now? What do you think?
I think it depends on how you define precision health. I think right now precision health is being defined more by, hey, more of the functional medicine kind of lifestyle, longevity type stuff, where take my lab work, feed it in, and see where maybe I can, hack my lab work a little bit. That's not how I tend to think of personalized health. To me, it's more, somebody's going for a hip or a knee replacement. Maybe there's things that we can do ahead of time to prepare them for surgery. Maybe the type of implant that's better for them. Maybe this person's not ready for surgery yet for whatever reason. Those types of applications, and less around the sort of trying to hack your lab work.
As I said, you could argue that Gen AI makes it like a little bit easier to be precision health-ish, right? Like Ben, to your point, like does it make actual precision health easier? No, but think about their initial kind of efforts, like the personal health record, being able to go and use like AI in order to go and see what else can happen with your personal health record. Those are precision health adjacent and should be at least easier to scale than before, where you needed a lot of folks on the ground to actually go and process the data. So interesting direction to go in. I don't know if it really takes off in a bigger way, right? I think you still need a core product, which Verily hasn't had in a while.
Yeah, I think it's hard to predict. There are a lot of great projects with the like medical twin. I think it's in the same area. But again, at the end of the day, if you want scale, you definitely need some of these big players. And Google, to their credit, they've been basically everywhere. They're just spreading their seeds, so to speak, whether through their venture or directly, or their Google X, what is it, incubator. So again, they're to their credit, they're trying everything just to see what sticks. In this case, I think in case of Verily, I don't know, I feel like it was originally Sergey Brin's baby, and he kind of moved on with his life, I guess, and it kind of like went on its own, basically went nowhere. But I think in general, precision health obviously makes sense.
All right, let's see how this plays out. Let's move to our next news. Doctronic is again in our discussion because we just recently, not just we, everybody was talking about this cool new pilot with the state of Utah with AI-based renewal for prescriptions. They got a lot of media coverage for that, and just a few weeks later, Doctronic raises $40 million Series B. Sergey, surprisingly, you wrote another piece on this, so I'll let you kick this off.
Yeah, the piece was critical. They now
No way.
raised.
Sergei wrote a critical piece.
Yeah, right.
Never.
When did that happen?
No, I kind of found some interesting details unexpectedly. Some of my sources kind of stood forward just in time, I guess, of this funding announcement. I don't know, just a lot of weird pieces.
Tell
What
us.
did you say?
Well, what's wrong? Tell us.
I'm
What's
not gonna.
wrong
I'm
with
not gonna.
Doctronic?
What you're supposed to ask nicely. Like if you say it like this, I'm not gonna tell you. Come on, man. So I mean, first of all, like I don't know, like the way their platform is just. I don't know. I'm not saying there's like unethical issues going on, but just kind of unprofessional. Like the claims they're making. So somebody pointed out to me, like, this. If you go to their website, it's always like this clock, right? How many consultations we made, and it's funny because it's almost like that's the number of their traffic visits. So it's like somebody views the website doesn't mean that there's a medical consultation. So I feel like there's definitely disconnect in terms of numbers they're advertising, which may or may not be ethical, but it's just kind of weird, and just kind of like the companies they're using for their, I guess, front end. It's kind of like a completely weird story because they did a completely unprofessional job in terms of making specific claims, and there's some company was involved that basically they copy pasted some statement. Another big one is that they only have one study they keep referring to, which is non-peer-reviewed study. If you look at the names of the researchers, it's funny, like outside of these two founders, 5 out of 6 names are out of Belarus, my home country. And this are like the guys who are like software developers. They're actually right there in the country, which I guess is fine, but like I feel like it's just weird. They're definitely not clinical researchers. I didn't see anything in their LinkedIn profile kind of suggesting they're into this research. I mean, they're part of the company, but I don't know. It's just a lot of strange things going on. What else? Oh, yeah. So I asked a couple of my clinician colleagues to take a look at their formulary. And I don't know, I mentioned a couple of muscle relaxers in my article. Like two of them, basically I asked two of them, and both of them claimed that they would never get this automatic prescription path. In other words, this particular drugs would never be automatically refilled, but they're still on this formulary. So probably most of the names are okay. Somebody got a refill, a prescription from their doctor, it's okay to refill. In certain cases, there's actually one drug that apparently the biggest ingredient of the street drugs called lean, Lean. So they're saying we definitely would not prescribe it like as a refill. But again, it's on Doctronic's formulary. So I don't know. I mean, I think for most of these medications, it's okay. I mean, it's actually a good thing that especially for somebody who doesn't have access to have automatic renewal. But anyway, a lot of questions. I'm gonna stop there.
Sergey, don't you kind of feel like this is just the convergent evolution of what Hims and Roe have been doing? I mean, access to drugs has been something that folks have been trying to solve for the past few years now. And if they can go and actually have some basis behind it, like an AI tool, as opposed to just doing it almost auto prescribing the way a lot of Hims is run, doesn't that make sense? Just to take the
No,
counterpoint.
in general, it makes sense. I'm just saying the way Doctronic is doing, and maybe it's because they're kind of the first kind of first comers. Maybe that's where there are all these issues. No, in general, I'm not against AI, especially in this kind of like easy, non-controversial use cases. I'm obviously for AI. So no, there's no argument there.
They're not just I mean that's what's gotten the most attention is the AI prescribing renewals, but they're also, trying to deliver care. I think they're trying to position themselves as sort of this AI native, full service doctor online or online, medical service, not just the pharmacy piece of it.
Which makes sense, right? I think the biggest issue I saw with the development of telemedicine is you had a bunch of burnt out doctors because you created more ways to access doctors, and it was like having your email on your phone. All of a sudden, everyone felt like a little overwhelmed by it. So having more access to care, it solves some problems. Having more care in general as an available resource, that's probably solving a much bigger portion of this.
That's interesting. I went and played around on their website a little bit this weekend, and you go on there and it's basically a symptom checker, an AI powered
Yeah.
symptom checker. And I, for a while, was on the medical advisory board of a company called Buoy Health. This was pre AI. I was doing something similar where you put your symptoms in and it tried to route you through, to top three potential diagnoses. Much harder
Like a
without AI.
more sophisticated Dr. Google.
Yeah, more sophisticated, taking the information in like an intake. And I'm not sure with Doctronic, my impression is that there, you get this AI powered intake, it gives you potential diagnoses and suggests next steps. At least that's what I got. And then I think tries to hook you up with somebody. I don't know if it's a live telemedicine doctor or they're planning on removing that from the equation and being full AI or maybe doctor review. I'm not sure what their long-term plan is for building that.
Well, I mean, they can't do the diagnosis, right, because they're not FDA approved, and that was the whole other story is that the way they got around the FDA rule apparently, which I think it was the whole point of the Stat News. I think I've seen it investigation that they're saying they're practicing medicine, not providing medical device, and that's how they get around the FDA approval rule, which is kind of weird, but I don't know. I'm not an expert, I guess, but just a lot of questions.
I guess how a lot of the companies do it is basically say we're just giving you information, we're telling you, we're educating you about these conditions. We're not saying that you have this condition. We're saying this is some common whatever condition, and this is some information about them. Sort of like the front end. But if it's just a front end for now, does it really solve the back end issues, or just a fancier version of an intake? And you're still, maybe the person on the back end that you're talking to is the clinician, has better intake information or has an AI summary that tells them what this might be, and they're reviewing it. Potentially, you could upskill, um, somebody that's maybe not an expert or in that particular problem.
But just to clarify, it did give you a diagnosis, right?
It gave me three potential diagnoses, what next steps might be to continue working it up. Like I gave it a very like vanilla, straightforward presentation of somebody with hip arthritis, and it did. It came up with number one diagnosis is hip arthritis, number two diagnosis is a labral tear, number three diagnosis is avascular necrosis, which is fairly appropriate for the scenario I gave it. And then it interestingly kind of wanted me to go into primary care, suggested primary care, not orthopedics. So I don't know if that was intentional. I can certainly see that happening, right? Stay away from the expensive specialist. It will hold us in primary care. And with AI, we can kind of upskill the primary care doctor to feel more comfortable with these diagnoses and managing these diagnoses in the primary care setting and when it needs to be sent to the specialist. I think that's an interesting, potential way to leverage these things. But that's kind of what it spit out. It did recommend X-rays, which was appropriate. It recommended lab work, which is not something I would necessarily personally send a patient for with hip pain right away, but it did recommend lab work, which was interesting.
Still working out the kinks.
Not necessarily wrong, but maybe a little bit aggressive, you know.
I just have one question to you guys. Sergey, that's actually mostly to you because I'm sincerely trying to root for AI companies in healthcare that trying to fix something. And you come up with every new article saying that each each one of those companies are crap and they're shady and stuff that. So which companies should I root for? I'm confused.
Well, we had Shiv Rao on the show. He seems to be a nice guy. A breach.
All right, all right. That's it. The only one.
I think it's valid though. I mean, I think you need a counterbalance, right? I mean, I'm personally getting a little bit of AI fatigue, right? With all the, unbridled, nonstop hype. It's going to replace this, that, and the other thing. And, here's what we're doing, and here's how much money we've raised. I think you need a counterbalance to that, some real world sort of grounding, particularly in healthcare. And I like this stuff, but I've kind of reached a saturation point where I don't really want. If there's a post on it, I kind of scroll by for the most point because I guess show me the evidence or at least show me a little bit of a balance to take at this point.
See, I have Ben on my side, Alex.
Now, I'm going to take the counterpoint here. I think hating on the blurred legality of a lot of these businesses is unfair because doesn't all tech innovation start like just a little bit illegal? Seriously, like Uber was a little bit illegal, right? It's a legal cab company. Airbnb, a little bit illegal, right? A legal hotel company. Telemedicine, when Teladoc came public, it was illegal in the state of Texas.
But my research is not only about legality. It's about a lot of things, including like how employees being treated inside the company, how they've built their models. Like I look at many aspects. I mean, it's not just about legality.
I think right or wrong, you're always going to get the pushback in healthcare. Well, this is different. It's healthcare and people's lives and livelihoods and whatever at stake. And that there's always going to be that friction, I think, and that's the friction that we are tend to see from the tech world. It's look, you make mistakes too. Doctors are not perfect. Why should AI be held to a different standard than physicians? And the physician pushback is, well, because we're held liable, we're held accountable. You're not right now held liable or accountable. If the AI messes up, who's responsible for that? The company, the AI? Is it some doctor in the loop that now is bearing all that risk? And why is that fair? And so I think that's the tension in healthcare, right or wrong, that you're going to get. People want to treat healthcare differently than hey, your Uber surge pricing or Uber's tactics with taxi drivers or what have you. Is that different than healthcare AI and its tactics with healthcare providers?
And let me just say that I feel like in this industry, people should be able to speak up, even inside the companies, if they see something, especially when there's like outright fraud. I feel like we missed like Theranos and Babylon and all these cases just because people are afraid. They're DMing me to use me as a middleman essentially to speak up on their behalf, but I feel like it's just wrong. I mean, they should be able to do it themselves. So, I mean, I'm glad to do it as a service, but like, I feel there's a lot of issues on that front in our industry, and we have to resolve it because this is just not right.
Yeah, we got that a little bit with digital health, with people talking about when Amazon was doing their healthcare, the intake phone system, with Cerebral and some of these other companies where people eventually spoke out and said they didn't agree with what was going on inside the company and some of the fast and loose things that were going on.
Right, Sergey, I like to give you crap, but I do enjoy reading your articles. So yeah, I hope you're gonna continue writing them. But let's kind of move from investment a little bit to M&A news. Universal Health Services announced that it has entered into a definite agreement to acquire Talkspace. Woohoo! What do you think?
It's a great deal for Talkspace.
For sure, $5.25 per share.
Yeah. 3 times revenue, that's pretty healthy for the rest of digital health. I think if you look at the way UHS stock has reacted, I don't think a lot of folks thought now was the right time to be buying a um, telemedicine player. I also think it shows that they've had a really successful pivot, right? Talkspace was a D2C player for the longest time. They started going more in a B2B direction under their new CEO, John Cohen, and they had a lot of success. And then when UHS bought them, they cited all those contracts. Like I look at Teladoc with BetterHelp and how they've been kind of a thorn in their side for a while. Um, I would imagine they're probably looking at a deal and thinking, my gosh, maybe there's an opportunity for this to be separated.
So how do you explain that everybody all analysts downgraded immediately? Talks. I don't even know what it means. Like after the announcement, what do even this downgrades mean? You know?
Oh, you downgrade immediately because it should be trading really close to the price of takeout. You go to neutral because it's like fair valued, right? There's not like a ton of upside. But I don't know. I mean, I look at that deal and it's not a great success if you got in Talkspace at the SPAC, right? The D-SPAC. But I would argue that that was a different time, right? That was a whole different world where we were valuing things a little more loosey-goosey during the pandemic.
I mean, do you think that's part of what's holding back, other M&A, I mean, IPOs are being held back for a lot of different reasons, but, everyone invests at the top of the market in these companies, and now, your valuation was out of control, that your exit you're kind of stuck. You're either going to exit with the investors being significantly, investment being devalued, or you can't really IPO, and some of these companies are too big to be acquired. You're sort of stuck in this purgatory of either having to raise more money or, essentially wiping out investors, or providing a not a great return on investment.
I actually think it's a lack of acquirers, candidly. I heard rumored that there were more than one bidder for Talkspace, which I was actually surprised about. I was really, really surprised about that. I don't think there's a lot of buyers for digital health assets. And if you look at how UHS stock has reacted, I mean, it shows that investors are voting with their feet. They don't want folks buying digital health assets right now.
Yeah, the reason there is one buyer is because Talkspace board voted for a non-shop provision, so the company cannot solicit competing bids, which was kind of weird to me why they would do that. And they also installed I'm reading here, 32.4 million breakup fee, which even further discourages rival bidders. I cannot understand why they would do that. Seems like it's in the shareholder benefit to have a bidding war potentially. So I don't know, because I mean, everybody's saying it's fair price, but the premium was only 10%, right? I mean,
But after a pretty heroic run of the stock.
of course, yeah, it was a good year, but like, yeah, I don't understand this provision at all. But anyway,
I would imagine it's, I mean, post the deal, right? There wouldn't be some sort of provision to say that they can't have multiple bidders as they're going through the process. When the process is done, it's done.
well, as they accepted the bid, they're basically also voted seemingly the board for this non-shop provision, basically for no more bids. Basically saying, UHS, you're the only, you know, acquirer here, so let's do this. I don't know. Seems like against the shareholder benefit, but I don't know.
Isn't that pretty standard though when you get to a certain point?
Yes. Yeah. I heard that there were multiple interested parties, so it wasn't that they were blocking anyone out.
And then there's walkaway rights and the whole 9 yards.
No takesy backsies is the
or
professional term.
pay a penalty, yes.
Yes.
But we'll see. Is that, why do you think, Stephanie, do you just think that digital health assets are too toxic that nobody wants to buy them? Or why do you think there's no market for digital health companies?
I just think in general, think about it this way. If you're a large public company, and those are most of the acquirers for these assets that have gotten to a certain scale, right? Like there's not a lot of private players that can buy these. You are going to be sensitive to how your stock reacts. And clearly the market is not valuing digital health companies. So even if you could buy one of these assets, if you would buy it and your stock would get nuked, why would you want to go in that direction, right? Then you can look at some of the larger players that used to be the big acquirers of digital health, like the Uniteds of the world. They're busy. They've got other distractions going on. So I just don't think you have a lot of potential buyers for these assets. Then there's always the moonshot. You had like a few different tech players that maybe would get involved. We just talked earlier about how some of the tech players are less interested in being involved in the space. So it's kind of a thin field of people that could buy these assets.
Yeah, a little off topic, but I think we're seeing a similar thing happen in like the PPM PE world with practices. Again, low interest rates. You're buying up all these practices, and now you're realizing that there may not be anywhere to exit them because same thing. You Optum, if you want Optum to buy them, well, Optum's sort of tied up with other things right now, not necessarily looking to take on some of these, PE-backed platforms. So interesting time for M&A.
But Stephanie, there's also like I was thinking the IPO market is pretty dried up. Also, looks like for digital health. So I was actually expecting more M&As because I don't. I mean, personally, I don't see. I mean, we've had a few obviously, but I don't see that big rush into IPOs from digital health. And my feeling as part of the reason is that they already had a good run as private companies, and they don't think they're going to do better as public ones. But I don't know.
It hasn't really benefited a lot of players that go public, right? If you look at the arcs of some of these players, Accolade's a great example. It was a solid platform, but there was such a dislike for digital health that I think they ended up getting acquired because they had to. They just couldn't get out of the hole as a public company. So I do think that makes sense for a bunch of players. Candidly, I think there will be a little bit of a pickup in M&A just because there's a less of a disconnect between buyer and seller valuations than there was before, right? I think there's been a little bit more rationalization of that versus maybe what you saw 1 or 2 years ago when folks were still kind of really clinging to those pandemic valuations. I also think in general, it's not exactly the world's best market to go public in right now. There's this Strait of Hormuz thing. It's very inconvenient. Stocks keep moving a bit volatile.
Well, we just had our episode with Christy Farr, and she said that this Talkspace UHS deal was the first ripple. So hopefully, things gonna get better in terms of M&A and maybe IPO as well. We'll see, but she seems to be optimistic.
All right, let's talk about policy a little bit. This news, not specifically health tech or healthcare related, but I thought we should still talk for a couple of minutes about this. So on March 20th, the White House released its national policy framework for artificial intelligence, together with companion legislative recommendations. So basically, the whole framework says that we are gonna regulate AI on the federal level, not giving a lot of power to states. And there are some additional guardrails that they're trying to put, like protecting children, safeguarding and strengthening American communities, and a few other things. But at the end of the day, it's still trying to be as friendly as possible to all the AI startups and companies out there. And we've talked about this a little bit before on our previous episode. What do you guys think? Is that a good move for AI development overall?
It seemed pretty self-contradictory to me in reading it. On the one hand, we want to put up safeguards to protect children and things like that. But on the other hand, basically
enable American AI dominance, right?
Right. I mean, it seems like the fox is guarding the hen house with this regulation, and now there's this, fight to try to supersede the states because several states have tried to put guardrails. Most famously New York recently, New York State trying to put guardrails around the use of clinical AI, and then the federal approach seems to be more hands off. Let them regulate themselves and figure out. We don't want to stifle innovation, so we're going to be more hands off. But at the same time, we want to protect kids. But meanwhile, Meta just lost this, lawsuit about how it's not really protecting kids, or was ruled not to be doing a good job of protecting kids. And from the doctor provider perspective, it just makes me wonder at the end of the day, if the companies that are building these tools get a lot of leeway, does that mean that all the liability is just going to continue to be heaped on, the providers? And I think that's what gives me pause, if I read it correctly, what's been proposed.
No, you read it exactly right. I think this is horrible for U.S. healthcare. I think the administration is trying to kind of put this contrast to the EU AI Act, which they consider, I think, draconian, and they're basically saying, well, we're going to do completely opposite. We're going to do this kind of hands-off AI Act. Obviously, kids have to be protected. This whatever else they had there, what is like fake AI, which I don't know, like in terms of healthcare for sure. Like I don't see any connection there. But yeah, Ben, you're right. Like for the states, it's kind of like it's nice maybe to have one law, but if this law kind of so much worse than the state laws, then it doesn't make sense to me. So actually, Colorado and California, they had this algorithmic bias protections for clinical AI in particular, which is, I think, very important in healthcare. So now we have this executive order that basically preempts the state laws. So now we're basically getting rid of that. And I don't see any protections, especially in healthcare. In fact, this liability shields that this last executive order as of March, it basically protects developers from consequences when their tools cause harm downstream. so basically, like we're protecting AI developers and not protecting the customers. So this is, which is in this case, physicians and patients. It's just wrong.
This seems like a broad framework, though, right? Like, I don't think healthcare has never been shy of adding in more regulation.
Oftentimes with unintended and bad consequences.
Yes.
I was going to say, don't you think health systems would be the ones who actually tell all the AI developers that, hey, if you want to be part of this, and if you want us to adopt your clinical decision support tools and many others, you have to get some sort of liability on your side. So yeah, even if on federal level it's like green light to everything, but I feel like health systems should step up and say, yeah, just if you want us to adopt anything you build, well, let's share that liability.
But Alex, who are these developers? OpenAI? They're like in Mar-a-Lago every day. Come on. The lobby is just crazy. So it's in their interest to have this loss, obviously. So I think I think it's important to look who's lobbying, who in Washington, and also in my opinion, we're kind of like in a what do you call it, lame duck session, so to speak. I don't think anything's going to happen until the new Congress going to be elected. So all these executive orders, obviously, it's nice, but until it's congressionally voted and ratified, it's all kind of just cheap talk, in my opinion.
But to Alex's point, I mean, that's sort of what got Doctronic a lot of press and attention, was that they got liability or some sort of malpractice insurance for their prescribing, and that differentiated them, and in a very competitive marketplace, being willing to take on liability or share liability might be a differentiator, or might give you a first mover advantage if you're selling into doctors' offices or hospitals and health systems. So
Don't forget, in healthcare, there's always the extra hurdle of actually getting a buy-in from the existing incumbents, right? So even though you can go and get your solution approved, who's going to buy it?
And that's why we see so many pivots, including Doctronic, because that's, as Ben said, that's not even their, at least hasn't been their main business. So yeah, I mean, we pivot, we try to make money, and this is how we survive, I guess.
Final news for today. We just talked in the beginning of the year about OpenAI and Anthropic announcing their health tools back in January, and now Amazon, Microsoft, and Perplexity all released their DPC health AI apps this month. So everybody seems to be going in that direction. Obviously, they see a lot of potential there, but do you think are we going to have just one winner, or they're going to share the market?
I mean, if you look at all the press releases, every single one said that's a major use of their platform already, right? Everyone had their own stats of some high number, high percentage of healthcare utilization. So it makes sense that they would have some sort of specific suite that they came out with. Um, I think it's more making a product to fit the market than vice versa.
Yeah, I mean, I think it seems to me that they're all fairly similar and that they're kind of these sandboxed, um, versions of an existing product. Because I think isn't Copilot based on OpenAI anyway, on ChatGPT anyway. But I think it makes a ton of sense for Amazon, right? As just kind of continuing their whole verticalization and front door and then feeding into all their other services. I guess my question is, are people that are getting their health information or putting health information into these models going to go to the health version of it, or are they just going to go to the standard, regular consumer facing? And does it matter? I mean, is there something special about the health version of the product that's more, protecting your information better? Is it more trained to give more accurate medically related responses, and will people use it? If it's behind a paywall, they're probably less likely, or if you have to pay for it, they might be less likely to use it than just going to a free version of something that may not be healthcare specific.
Can I give a controversial view on this?
I wouldn't expect anything else.
So I think maybe with the exception of Amazon, because it's kind of like natural extension for them because of One Medical to essentially have the service and connect to the data that One Medical already has. Everybody else, whether it's Anthropic, OpenAI, Perplexity now, all these guys, in my opinion, they're just middlemen for the patient data to be processed. So like let's take an example of Microsoft. They've been sitting on the exactly same product since October, before everybody else, and no one was using it. In fact, it was called Copilot for Health, and they just renamed it with this new release to Copilot Health, like exactly the same product. So what they did was basically they hired Health EX, which is basically connection to the patient medical data, and all of a sudden everybody like started using it. So in my opinion, it's the play on the interoperability and API to patient data as opposed to all these LLMs. Because in this particular scenario, LLM is just how you process the data. If I'm a patient, I want to use connection to my data. How I process my data is kind of like my business. Like, why should I use OpenAI or Perplexity? I can even use Excel. So for me, it's the win for all this interoperability services like BeWell and HealthX, and not so much for LLMs. Like, I think at some point this connection service is just gonna think how they're gonna use it as a separate service, and I think they're gonna even make more money down the road doing that. So that's my take.
It's all about the data.
It's all about the data bit.
All right, guys. Thanks so much for joining, discussing this interesting news happening in the space. Please subscribe to the channel, as always, and looking forward to our next episode. Thank you, guys.
And welcome, Stephanie.
Yes, welcome.